is Carolina from the University of Macau. It is such a great opportunity to share with you the results of our study, which investigated pharmacists' intention to contribute to COVID-19 management. To give you a bit of a background about Macau and Macau experience with COVID-19, Macau is a very small city, as many of you may know. It is also a very a popular tourist destination. As you can see here, just last year, Macau had received nearly 40 million visitors. So you can imagine in our fight against the pandemic, we are really challenged by the close proximity among ourselves and the risk of imported cases. On the right-hand side of the slide is our COVID-19 statistics. As of today, we have a total of 46 COVID-19 cases. All of them, fortunately, have recovered. Now, here is the brief timeline about what's happened in Macau in the past 9 months. The actions against the COVID-19 pandemic actually started as early as January, and along this time we have, a series of preventative measures, quality control, control actions, collaborative efforts, to fight in joint forces. But one of the things that I want to highlight here is the guarantee mask supply scheme. This is the key whereby pharmacists were put in the forefront right from the beginning to join the forces against the pandemic, and this is how it worked. The government in Macau considered that it is important for the people to wear masks to prevent the spread of the virus. On the day after the first COVID-19 case was reported in January, the government announced a scheme which guaranteed all the people in Macau one face mask a day at an affordable price. The government also decided that it would be best for the community pharmacies to be the distribution location. As you can see here, people did line up in the community pharmacies, showing the ID, get a share of the mask. But at the same time, the opportunity for the pharmacists here is that they were already put in the forefront to be the first contact for many, if not all, of the people in Macau. So they were already in the position the position to provide advice, education, and other interventions whenever needed. And this is exactly what they've done. A lot of the pharmacists have stepped up their role during the last 6-9 months to keep the public informed, to give them education, to continuously give them the healthcare service, healthcare advice that they need. And some pharmacists even step up to become more vigilant about suspected cases. So given these Macau experiences and other experiences in the other country, we know for sure that pharmacists have a key role to play in responding to COVID-19 pandemic, especially in the long run. However, we don't know much or we don't know enough about what determines pharmacists' intention, which would have a great impact on their practice. This is why we have this study. In this study, we employed the theory of planned behavior to design the survey so that we can try or attempt to assess what determines the intention. The highlight here is the theory of planned behavior is a well adopted, well-tested, robust psychosocial models which have been widely used in pharmacy practice previously. And there are 4 constructs to this theory, which is the attitude, subjective norms, perceived behavior, control, past behavior. It is really about how these 4 constructs are going to affect the intention, which would have impact on the behavior. And based on these findings, we're going to try to explore strategies that can help reinforce the intention, hopefully to improve the behavior. So let's look at our results. We have received 284 responses from the 700 pharmacists that we have invited, so which is a very reasonable response rate. And if you look at the overall results showing that the means of the constructs, or the four constructs and the intention, it is really based on a set of statements that we have set up for each construct. For the pharmacist to rate their level of agreement on a larger scale, or to indicate their frequency of practice based on their experience. All of these multi-item scales have high Crowback Alpha's coefficient, indicating a good level of reliability of the survey tool. And here you can see that in terms of attitude, we have the longest green bar showing a very strong positive attitude. But, in the middle section, when it comes to subjective norm, a lot of the pharmacists were not sure whether, customers or other healthcare professionals think, it is important for pharmacists to make such a contribution. So there are doubts about how other people think. At the bottom section is really about pharmacists, perception about their abilities or other enablers they have in hand to support their practice. And the red bars really just to indicate pharmacists' concerns for the lack of support, especially in the software and the hardware aspects. Okay, here we also compare the intention of to practice, which are the green bars, and the frequency of practice based on their previous experiences, which are the yellow bars. As you can see that there are great gaps between the two, indicating that more actions are needed to close the gaps and to give them better support. Other questions, here the regression analysis shows that, out of the four constructs, only the attitude and the past behavior were the strong predictors of the intention based on the result of the studies, and there are much to be interpreted to find out the underlying implications here. We further ask about other enablers pharmacists think is important to them, and three themes came up, including the communication, collaboration, especially with the government, pharmacy management, and in fact, pharmacists want continuously to learn about, say, the COVID-19 scientific updates, the environmental hygiene techniques, or even the quality standards of the face mask. So all in all, what I'm trying to convey here is that pharmacists should be well positioned between the government and the general public to bridge for the actions against the infection at community level to really go ahead to make a success. But for pharmacists to be able to do that, we have to reinforce pharmacists through different techniques or strategies. And based on the results of this study, it is important for pharmacists to be encouraged continuously to embrace the role. And the public and the other healthcare professionals should be aware and appreciate the significance of the pharmacist's role can make in the entire COVID-19 management strategy. And ultimately, it is crucial to ensure pharmacists are well trained for the tasks. So as a conclusion, I would suggest that people, when we want to move forward to, think about specific strategies, there are other dimensions that we have to consider, such as the scope of our service target, how to become more proactive, how to better establish a role in the public health issues, and what are the tools that we need. And eventually, are we ready to join forces among ourselves to become a more reliable community network to serve the community better? So with this, I would like to end my presentation here, and thank you for your attention.